Now we'll have the first presentation. As our societies closed down in February 2020 due to the pandemic, the health services had to find new ways of reaching the patients. The Norwegian non-governmental organization, the Blå Kors kompasset, offers therapy to young people growing up in a family affected by alcohol or drug-related problems. And our researchers followed therapists and patients as the health services were disrupted due to the pandemic. Marianne Trondsen is a sociologist, works as a senior researcher, and holds a PhD. Sollid Manskow is a researcher, holds a PhD, and is a registered nurse. We will also meet Frøydis Eidheim, the leader of Blå Kors kompasset, and a user telling about her experiences. Welcome to all of you. And first, it's Marianne.
Thank you, Irene. Thank you, Irene, for the presentation. I am Marianne, and I will have this presentation together with my colleague, Manskow. And as Irene said, we also have a video of Frøydis Eidheim. She is the director of Blå Kors company, Compass, and also from one user. And our presentation is about our collaboration research projects about video-based therapy for youths who have a parent with alcohol problems or substance abuse. And Blå Kors Compass is a voluntary organization who gives therapy and support both physical and video-based. So today, we will present the research project in all its phases, and Frøydis will present the organization. This is an ongoing research project, so we will present the results from 2 of the part studies and telling something about our ongoing research. We do the research from 3 perspectives. We want to learn more about the experiences from the leaders, from the users, and from the therapists. Frøydis will say more about the situation for children and youth as next of kin in families with alcohol and drug abuse. But I will say something because it's so important to understand why it's important to give help and support to this target group. It's a problem in Norway, and I think in Poland and all over the world, that many children and youths have a parent with alcohol problems or other drug abuse. And there is a lot of research, a body of knowledge, that this affects the children by emotional, social, and practical challenges in their everyday life. And they taking responsibility in their families and have a high caregiver burden and do a lot of more houseworks and helping in the family and with siblings than other peers. And living with alcohol problems, it's also living with a lot of worries and having a family life, which is a lot of unpredictability and instability. And for some, there are seriously challenges, such as violence, sexual abuse, neglect, poverty, and so on. And we also know that early help and support are helpful. But at the same time, we have this social stigma and shame and blame around having alcohol problems or other drug abuse. And all children have a high loyalty to their parents, so it can be difficult to ask for help. So it is a need for low for information, help, and support, which is easy to find and easy to get. This is a foil in Norwegian, but the text on the picture underlined that in Norway, children as next of kin are and have to be a part of all healthcare services. And in Norway, as one of the first countries in the world, this is stated by law, that all health personnel and the specialized healthcare services have to ensure that children as next of kin receive necessary information and support. The law was established in 2010, and that's really good that we have this law. And there is done a lot to meet the children's perspective within healthcare. However, there is still an ongoing process to implement the law in the hospitals and the primary care, and to develop health services to follow up children as next of kin to meet their needs. And by next of kin in this law is all minor children of patients with mental illness, substance abuse, severe physical illness or injury. And the law says they had to ensure that these children receive information, support, and follow-up that is necessary. But one way to meet children to meet their needs is to develop digital services to this target group. As we know, children and youth are very familiar to use digital communication, and we can say they are living much of their lives online. We also, it's not new, and to use video-based services. And it has been used in the mental health services for several years, also before the pandemic. However, after the pandemic, much more mental health services have tried this out and implemented it as an ordinary option for users. From the research, we know that video-based services in mental health care can give better and faster access to treatment, save time, travels and resources, and give lower threshold for seeking help, and also can be a safety net for patients, which is really important in Norway with long distances. However, there have also been found some technical challenges and barriers, and also to get a near contact through the video. However, mostly of the research is from a healthcare provider's perspective. There are few studies about user experiences, especially from the children and youth's point of view. And user experiences are important to develop new video-based services and to ensure quality. That's why we do this study. And now we will play a video of Frøydis Eidheim, the leader of Blå Kors Compass in Norway. And she will also tell us about the background for why they started this video-based service.
Blå Kors Norway is the major Norwegian non-governmental organization working in the field of alcohol and drug abuse. Our work is focused on preventive measures, especially regarding children and adolescents, as well as treatment and follow-up after treatment. Alcohol is the most widespread drug in the Norwegian society. It's a legal drug that is used by most people in various occasions and contexts. However, alcohol causes significant public health problems. In Norway, the harmful effects of alcohol consumption are under-communicated, and it's common to underestimate one's own use of alcohol and its effects. The Norwegian Institute of Public Health points out that more than for any other drug, alcohol use has significant negative consequences for the people other than the users himself. Among other things, high alcohol consumption can harm children, spouses, partners, and other family members in various ways. Norway has a population of about 5.4 million people. Calculations done by the Norwegian Institute of Public Health estimates that 50,000 to 150,000 children have at least one parent with risky alcohol consumption, and that around 90,000 children have a parent with an alcohol use disorder. An extensive international research literature has shed light on how children of parents with alcohol use disorder or risky alcohol consumption have increased incidence of various psychosocial problems. These children often have a greatly increased risk of negative life events, such as serious illness in the family and parental divorce. They are significantly more exposed to violence, sexual abuse, abuse and neglect, and they have a higher probability of developing their own alcohol or drug problems and mental disorders. Blå Kors kompasset is a service that offers therapy to youth aged 13 to 35 years that have grown up in families struggling with alcohol or substance abuse. They need help on account of long-term childhood exposures. Kompasset is a free, low-threshold mental health service. Kompasset has 6 departments scattered in different parts of Norway. Our staff are highly skilled psychologists and family therapists. Last year, we had more than 1,100 young people in treatment, and more than 40% received video-based therapy. Why did we launch video-based therapy for this target group late autumn 2019? First and foremost, only young people who live geographically more or less close to our locations could benefit from our services. We wanted to be a nationwide service. Offering video-based therapy would create an opportunity to provide help to young people all over the Norwegian country. And not only inside our borders, we would offer the service to youth that for different reasons stay abroad for a period of time, such for instance as Norwegians studying in universities in Poland. You will hear from one of them later in this session. We would also achieve another important goal in Norwegian health policy: equal opportunities to get low threshold mental health services. Digitalization of health services is a priority area and is emphasized in the Norwegian government strategy for good mental health. Web-based treatment opportunities in mental health was called for, and such services should be developed and researched more thoroughly. Blå Kors kompasset took this challenge seriously. It was important to ensure quality and build up knowledge about the use of new technology within the field of mental health service. That's how a good and lasting collaboration with the Norwegian Centre for e-health research came about. The research project started in March 2020. The timing couldn't have been better. Lockdown due to COVID pandemic had a side effect or unintended consequence that all our therapy services had to be digital due to infection control considerations. The need for our video-based therapy exploded. Today, 2.5 years later, Blå Kors kompasset has delivered more than 8,000 hours of video-based therapy. The researchers has followed this development closely. I'm now both happy and excited to hear our researchers, Marianne Trondsen and Manskow, presenting the results from the research projects. Thank you.
And then you heard about the start for the research project. So this project is based on a collaboration project, which is a near and good collaboration with the Blue Cross Compass. And it was interesting that at the end of 2019, the Blue Cross Compass asked our research center for collaboration about doing research on their implementation and experiences with what they planned to do, a video-based service. And originally, this was planned to be implemented during the whole 2020. But this didn't happen. So our research is to explore experiences with the video-based therapy from the perspectives of the users, but also from the therapists. In the whole project, we have had and have a continuous dialogue with the leaders, with the department leaders, with the user advisory board and a reference group. And we also have had co-research with some users during the whole process. We have did our research in 3 parts. First, the first study, we did a digitally focus group interviews with the department leaders during the pandemic in 2020. The second study is a digital survey to the users of video-based therapy. And we will use most of our presentation will be about this survey. And now we are doing interviews with users and therapists. So the study 1, how did they do the video-based therapy during the pandemic? Because of the pandemic and the lockdown of the whole society, the Compass offices were physically closed down on the 12th of March 2020. So all the therapists had to do their work from home. And they had to conduct therapy sessions online. Only a few of the therapists had tried this before. And quite impressive, the organization and the therapists immediately started to follow up their users digitally from their home office. And this turnaround happened from one day to another. And for us as researchers, this was a unique opportunity to explore their experiences. We have written one scientific publication about this study. Unfortunately, it's only in Norwegian, in Tidsskrift for psykisk helsearbeid, which is a Norwegian journal of mental health services. So we did the focus group 4 weeks after the lockdown. And we asked for the department's leaders' experiences. And they, of course, find this transition to video-based therapy from home office. It was an abrupt transition, but overall, it went very well. And the change conditions provide both new opportunities and challenges related to doing the same in a different way, creating closeness at distance, and being available for the users. So this was the 3 main issues they discussed in these focus groups. And in summary, all the therapists was very glad that the organization was able to maintain an available service for the users during the pandemic. The organization's adaptability was essential because the equipment, routines, risk assessment, and training were already established before the pandemic. They find it really important to ensure trust and safety for the users during the sessions. And that was especially important because both the therapist and the user was at home in this pandemic situation. And this implied that both the therapist and the user had to be flexible to find a safe and undisturbed place to talk. They find it that the video-based therapy worked very well related to the pandemic situation. And they were glad they were able to provide a national, equal and available service to the users. And then my colleague Un will tell you about the study 2.
Thank you, Marianne. So, in study number 2, we explored the users' experiences through an anonymous digital survey. And the target group was users who had experience with video-based therapy through the Blue Cross Compass. And the survey was performed in the period from October 2020 to January 2021, so in the pandemic period. And from the start, we designed the survey in close dialogue and cooperation with the user advisory board, the therapist, and the reference group. And we had several meetings online and sent the drafts back and forth to get feedback through the whole process of developing the survey. And this was important to us to be able to design a content in the survey that was relevant for the user group, both for the main areas and the questions within each area. And then the survey was piloted on several users during the development to get feedback on the content, layout, and the ability to attend the survey from different digital platforms like iPhones, iPad, computer, website, etc. And we just got this article accepted for publication in the Norwegian journal, as Marianne mentioned, that we had our first study published. But I will give you some main findings. And this article is based on co-research with some users involved during the whole process until publication. And that was a really good and interesting process where we discussed and wrote the results, the interpretation of the results, and the discussion along with the users. So I will give you some information about the survey contents. We collected some background information of the users, such as socio-demographic information, age, gender, living situation, education level, etc. And we wanted also to get knowledge about the reason for the type of therapy they selected. Was it because of the pandemic, the relationship they had with the therapist, or long distances? We also wanted to know which type of the therapy service the users preferred if they could choose. Did they want only video-based therapy, physical attendance at the office, or a combination of both? So, some results. So about the participants, 129 users participated in this study. That gave us a 53% response rate of all of those who got the invitation. There were 85% were women, and 65% of the participants were over 25 years old. So very few of the youngest users participated in this survey, which reflects the composition of users of the Blue Cross Compass in general. And it is hard to reach the minors. And half of the participants had between 1 to 5 hours of video-based therapy, and around 30% had only used video-based therapy and not physical attendance. So the survey contained 5 main themes and had a total of around 35 questions, meaning that each main theme consisted of from 4 to 8 questions. The first main theme was general experiences, so relationship with the therapist, the ending of a therapy session, the technical quality, and practical conditions. And each question was rated on a 6-point Likert scale, from 1 strongly disagree and up to 6 strongly agree. So I'll give you some results from the general experiences theme. As you can see on the right side of this slide, there were 8 questions in this main area. And on average, the participants gave a high score on the therapy sessions being helpful, it felt safe, it was practical, and it was not uncomfortable. But of all participants, over 50% preferred a combination of physical and video-based therapy if they could choose. Only 8% wanted video-based therapy alone. So from the other main topics, most participants experienced a good relationship with the therapist through video therapy and felt both supported and respected. A video-based therapy saved time, was flexible due to the ability to adjust therapy sessions to their school and working situation, and also the ability to have therapy independently of where they lived. And the participants experienced few technical challenges. Generally, it was easy to log on, and the sound and picture quality was good. So to sum up, the study shows overall good experiences with the use of video-based therapy, but we also found some differences between the age groups on the experiences. When we analyzed our data further, we found some differences in some of the questions related to age groups of the participants. The youngest users scored differently than the older age group, related to that the youngest felt the video-based therapy to be less safe, to be more uncomfortable, and more difficult to be able to have therapy undisturbed than the older participants. And the youngest participants were naturally those still living at home with their parents or living with friends when they took their education. And now we will hear from a user's experience.
I started my journey with therapy while studying in Poland. I started with in-person therapy and would therefore have to schedule my therapy sessions between vacations and semester breaks. This also meant that I couldn't have therapy very often, and therefore all my therapy sessions were very prioritized and important to me. At the beginning of each session, my therapist would greet me with a cup of coffee and ask me how my day was going. I always felt safe and comfortable at my therapist's office. After every session on my way home, I would spend time reflecting over what we had discussed in our conversation, and this was my normal routine. In March 2020, when COVID hit Norway, most therapy in person was shut down, and I didn't really notice a huge difference because I was used to having to wait to do therapy until I came back home. I had the opportunity to start online therapy already from the beginning of March 2020. My therapist had to ask me several times over several months before I said yes to trying. I was so used to my regular routine that changing that made me nervous. And I eventually decided to say yes due to several reasons. First of all, my therapist thoroughly explained how online therapy would work. And secondly, she really believed that I would benefit from the therapy while I was studying in Poland, instead of waiting until I got home. There were a lot of things that made me nervous about online therapy. I was nervous about sharing my personal feelings, as well as my personal space over a camera. I wondered if the connection with my therapist and I would feel the same as when we met in person. And I was even more nervous about how it would feel after therapy. How would it feel sitting in a room by myself after therapy? Shutting off the computer would give me a more abrupt ending to the session than I was used to. And not having time to reflect on my way home also made me nervous. I also thought a lot about how I would communicate with my body language, and I was very worried about where I should look during the session. Should I look directly into the camera or should I look at my therapist? I also expected online therapy to feel way more distant and impersonal. However, I was wrong. When I had online therapy, I would choose to sit in my own apartment where I would be alone so that I felt comfortable discussing my feelings and difficulties. I would make sure that I was logged on at least 5 minutes before the session, and I would always use headphones to make sure the audio was good. I would make sure that my day wasn't fully booked so that I could take the rest of the day to relax and reflect after each session. In the beginning, I felt like the ending of each session was very abrupt, so I learned to take time for myself after each session to reflect over the conversation. What made a huge difference for me was that my therapist would always start by greeting me the same way she did when we met in person. She would start the conversation light and let me decide what I wanted to share each session. Already from the first therapy session, my worries and concerns were put at rest. I very quickly became relaxed and was able to benefit from the therapy given. I think part of this was due to knowing my therapist from before, but she also seemed confident that this form for therapy would work, and it really made me believe in it too. Because the relationship between me and my therapist already felt like a safe space, sharing my feelings over a computer screen felt very natural, and at times it even felt like I was in the same room as her. Online therapy gave me a whole new opportunity as a student far away from my home country. I was now able to talk about the challenges I was facing right away, and this made me more aware of how I could help myself in specific situations. Before, I would have to wait until I returned to Norway, and the challenges I was facing didn't seem as relevant as they did when I was in Poland. Everything felt more distant when I had to wait to discuss what I was feeling. So for me, online therapy gave me a huge benefit of receiving therapy right away as the challenging situations were unfolding. If I were to give any advice regarding online therapy, it would be to make sure to take time to yourself both before and after each session. This may include anything from 5 to 10 minutes or even longer, as needed. Make sure that you're in a room you feel comfortable in. If you feel uncomfortable discussing your feelings around others, make sure that you're alone and make sure that you're in a safe space. I also encourage you to think about what you would like to discuss in therapy beforehand so that you're more ready when the session starts. I hope my experience with online therapy can motivate others to start the same. I can't underline how important it was for me to partake in therapy during my studies, and this would never have been possible without online therapy. Thank you all for listening.
Thank you for that. So to sum up the user's experiences, as I said, it was mainly positive experiences with the video-based service. But we have to be aware of the youngest users to ensure they have a safe environment to have sessions in. It's really important. And it's also important to try to get hold of the youngest from 16 to 20 years old, and most of them living at home. It's also important to ensure a safe location for the video-based therapy. And the development of the new services must be in a close dialogue with the users, as we've been talking about, both me and Marianne. We also need to offer broad and flexible services, and it is important to offer both physically and digital video-based service, as our survey showed. The therapy services, people have different needs and preferences, so the therapy services has to take that into account and have a broad and flexible service. And our study shows the potential with video-based services, but also some challenges.
And then, where are we now? What is the way forward? We are now in the study 3. This autumn, we do interviews with both users and therapists. And that's because we want to explore their experiences more in depth, finding the nuances and the context they do their therapy sessions, and learning more what is behind the survey. So, and people are different, and both the users and the therapists. So we hope to get more about all the experiences. The plan is to write a publication about this interview study, and we hope this will be in English, so we can bring the results out to a broader to people outside Norway. And we have a lot of presentations and dissemination about the project. So then it's time to say thank you for your attention.